Hello, hello, hello. Welcome. Hello to everybody. Welcome to today's training. Hello to everybody that is watching on Instagram. Hello if you are watching in the Clinical Connections Mentoring Facebook group. And hello if you're watching on YouTube. So I've gotten a bunch of messages recently from students who have just graduated or they're going to be graduating in the next couple of weeks. Most of them are feeling a little bit unsettled, right? So they're feeling a bit overwhelmed with the upcoming in between period. So that period between graduation and starting their first job. And they're overwhelmed with for a variety of reasons, right? Not knowing what setting they want to work in. Some of them not yet getting a job offer, but their classmates have gotten multiple job offers. Some are, they don't know, they just don't know what to do with this time. And sadly, some are even questioning if they even chose the right degree based on some of their clinical experiences or things that they hear through social media on the internet. A lot of cynicism around the profession, so they're hearing that and they're like, "Ooh, did I even pick the right degree?" So that's what today's training is going to be, right? How to navigate that space between graduation and your first job. So, for anybody new here, I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that there is for physical therapists. I have done a lot of outpatient, I have done acute care, I've done oncology, I've done pediatrics, travel therapy, home health therapy. Most of my career has been in skilled nursing facilities. I was a rehab director at a skilled nursing facility for a few years. Um, I have done adjunct teaching, I've done lab assisting in PT schools, and now what I do is I have my own cash-based practice here in Florida, and I'm also the owner of Clinical Connections Mentoring, which is where you are today. So what I'd like to do to start with, if you are watching live, please type live in the comments, um, and tell me who you are, where you're watching from. Same thing if you're watching the recording, please just type replay, who you are, where you're from. I just like to know who I'm talking to, and who's watching these. So let me start by saying that if you are feeling this kind of way, overwhelmed, lost, stressed, nervous about what to do after graduation, you are not alone here. It is really normal to feel this way, right? For so long, you've known what the automatic next step was going to be. You graduate high school, the next thing is to go to college. Your junior or senior year of college, it's time to apply to PT schools. You graduate college, it's time to go to PT school. You always knew what the next thing was, what to do next. But now there's a lot of options, right? For most people, those options are not always very clear, right? So to start with, the PT profession allows a variety of settings to choose from. There's a variety of patient populations that we can work with. There's a variety of specialties to choose from. So you want to first figure out what setting or population you want to work in. This will likely come from your experiences on your clinicals, right? So, was there a specific setting or age group or diagnosis that you liked working with most? If not, and this can be true for a lot of people, that's okay. This is actually me. It was me, it is me. I like variety. So, I like working with just about every population and every diagnosis that you can think of. There's only a few I don't like, that includes wounds and working in the ICU. So, I've always known to look for jobs that don't include those things or, avoiding those settings, but pretty much everything else I enjoy working with. And I especially enjoy variety throughout my day, throughout my week. So I've always looked for jobs that offer variety. Okay. My first job it was called a rotator position. So I accepted a job within a hospital system. That job had me rotate settings every 3 months. So my first year, I worked in outpatient for 3 months, and then I went up to acute care for 3 months. Then I worked in the skilled nursing facility for 3 months, and then I worked in their sports clinic for 3 months. It was actually pretty perfect for me. Then in my second year, that job turned into a split. So I did Monday, Wednesday, Friday, I worked in outpatient, and Tuesday and Thursday, I worked in skilled nursing facility. So that offered me variety within the week. Then my next job was as a travel therapist, where I did skilled nursing facilities. I worked with pediatrics and home health and outpatient. So again, more variety. Then I got a job at a skilled nursing facility that also provided outpatient services to the community. So if a patient was discharged from the skilled nursing facility, they could come back and we provided their outpatient therapy. And we also did home health. We provided home health to the assisted living and the independent living facilities that were on our campus. So I've always found myself in jobs where I was allowed to treat a variety of patients and a variety of diagnoses because that's what I enjoyed most. So start with deciding the population or the setting that you enjoy most. And if you don't have a favorite, that is okay. Think about some of the options that I just shared with you and look for those in your jobs. Okay. Now, you might have to ask for that type of job or you might have to create it yourself, but that's okay. If that's what you want, ask for it. Right. Okay, the next decision that new grads tend to make is, should I do a residency or not? Okay, this decision can be stressful for a lot of new grads, right? So, choosing a residency means that you are picking one specific patient population to work with. This has a tendency to kind of silo you into one area that you can become very skilled and very knowledgeable in working with. But sometimes, as a new grad, this can be a negative thing because right away you start to focus on one body system or population and you never really get a chance to work with other diagnoses and populations. And by doing that, you might limit your growth within the profession in a profession that has a lot of career options. Okay. So, that might be for you. That might be the best thing for you to focus on one thing. But if you're not quite sure, you're not 100% into that into that specific specialty, that might not be a great thing because it is going to limit you to learning only about those things. It won't make you a very well-rounded therapist, okay? The other thing is schools tend to push the idea of everybody doing a residency, right? So the problem with that is that not a residency is not for everybody, okay? Residencies tend to require 50 plus hours of work a week. It's significantly less pay than accepting a full-time job. And there are a lot more job requirements in addition to working in a clinic. So it could be that you have to also work in the athletic training room, or you have to teach courses, or you have to do journal clubs, or you have to, you know, have 4 or 5 presentations over a certain period of time. So it's not just working, right? If you're going to do a residency, you're working more, you're getting paid less, and you have a lot more requirements than just treating patients in the PT clinic. So you have to decide if this is what is best for you right now. For some people, that is. And for other people, it's not. You have to make the choice to start a residency for the right reasons for you right now. They'll always be there. So maybe you work somewhere and kind of just get a lot of experience and then you do a residency in your second or third year. That's okay too, right? But consider all aspects of the residency and decide if that's what's best for you right now. Now, after you've figured out the setting or the population that you want to work with, then you've decided whether or not a residency or specialty is for you, then it's time to start applying for jobs. And I will always recommend to apply to multiple jobs and go on all the interviews. It's best to then compare all of those jobs to one another, find the best fit for you. Okay. Now you need to what do you need to think about when you're comparing those jobs? You need to think about salary. What are the hours? What's the schedule going to be? What is the PTO or the holiday time? How much time do you get off? Is there mentorship available and is it what they actually say it is? What are the benefits? And remember, benefits I have put a cost number, put a dollar amount to those benefits. That is money you are getting. So think about the benefits. What's the location? How far do you have to drive to that location? And also what do they provide for professional growth? Okay, so you need to think about all those things. Never accept the first job offer that you get. Always, always, always look at all of your options and figure out the one that is best for you. Okay. Now, I want to circle back to something that I said at the beginning, which was that a lot of new grads feel very stressed because their classmates are already at this point. They've already been their classmates, their friends, they're already getting job offers. Some of them have already accepted their jobs. And that sometimes can leave you feeling behind. Okay. The imposter syndrome is going to start to creep in. You're going to start to compare yourselves to your classmates who've already gotten jobs or been offered jobs, and you don't have any of that yet, right? What tends to happen is you're going to start to think things like, I must not be good enough. I must need to work harder. I must not be applying to enough places. I must be moving too slow. To all of this, if you're thinking any of those things or all of those things, I say, who cares, right? You are absolutely good enough. You don't have to work harder. You should always move at your own pace. Remember, everyone is different and everyone's situation is different. You are allowed to be picky. You're allowed to only apply to jobs that actually interest you. You're allowed to say no to job offers if they don't align with you. So don't compare where you are now to where your classmates are now. Okay? There are a lot of differences here. So you cannot compare yourself to your classmates and your friends. And trust me when I say that you will be so much better off in the long run if you take your time and figure out the best job for you. Okay. To follow that up, I also want to say take your time. There is absolutely no rush to finding a job. Take the break. Okay. You've worked your ass off over the past 3 years, giving your all, spending hours, long hours of studying, giving up your vacations and your family time so you could focus on school, missing out on life events, working on group projects and class assignments. So allow yourself the opportunity to just be and just relax. Celebrate this amazing accomplishment that you just completed and just enjoy that free time. Because once you start working, that free time is not going to be readily available as it is now. Okay. Once you start working, you don't have as much free time as you have right now. So just take the break right now and breathe. Okay. So if you find yourself lost or nervous in that space between graduation, walking across that stage, getting your degree, and entering the working world, first, take a deep breath and enjoy the freedom. Second, do not compare yourself to your classmates. You are completely worthy of a job that you choose that meets all of your hopes and dreams as a rehab professional. Third, figure out what setting or population, or maybe combination of those, that makes you the most happy and start applying to those jobs. And if you're like me and you want something with a little bit of variety, create it or ask about a position that fills that for you. Then, once you've done all that, you've gotten offers, you've gone on interviews, compare all of your options and choose the job that is best for you. Ultimately, take one step at a time. If you find yourself worrying about how to negotiate your salary, but you aren't even sure what setting you want to work in, and you haven't even applied to jobs yet, take a minute and pause, step back. You are way too many steps ahead. Okay. Take one step at a time. Okay. Think about what needs to happen right now. Focus on that. Don't worry about the next 4 or 5 steps ahead of you. Focus on this step right now. Okay. Now, this is a major topic that I cover in my Complete Clinician Mentoring Program. It's something that I get asked a lot, and I spend a lot of time here with my clients. There is a lot of noise out there with like thousands of people telling you what you should and shouldn't do, where you should work, why you should or should not work somewhere, but telling you that you should do a residency, that you should be making 6 figures. But the reality is that this is different for every single person. My role is to support and guide you to help you figure out what is best for you. And I dive much deeper into all of this inside my mentoring program. We talk about everything from imposter syndrome to choosing that first job, to communicating effectively, to strengthen your clinical reasoning skills, even things about financial literacy. Okay. It's more than just a clinical mentorship program. It's a program that addresses literally all of the things that a new grad will face as they enter the rehab world as a licensed clinician, right? It covers a lot of the things that PT school didn't teach you. Okay. My goal is to guide clinicians to gain the power, the courage, and the confidence to build a career free from burnout that allows you the freedom to love your job and also enjoy your free time. Okay. So if you are interested in getting more support or information about this program, please reach out, send me a DM, or just go ahead and drop complete in the comments below. I'll come back, I'll give you the information that you need to apply, and we're just going to chat more about the program. Applying is not a commitment, it just gives you the opportunity to talk to me more about the program, to get more information, and to decide if that is a good fit for you. Okay. I hope you learned something new today. Please go ahead and drop in the comments your aha moment or something that really stood out for you or something new that you learned. I want to thank you for watching, whether you're watching on Instagram or the Facebook group, or you're watching on YouTube. If you have any questions about anything that I talked about today, please, please, please feel free to message me or just drop your questions or your comments below. I will definitely come back and answer them. Right? I will see you next time.